We're going to look at the eye gel now, inserting it when other airway adjuncts are not working correctly and we need to upgrade the airway because of potential vomiting threats, or somebody with a high risk airway, for example in pregnancy, or somebody who has been poisoned, i.e. an overdose. We would always try and maintain the airway with a OP or nasopharyngeal airway, but when that's not adequate, we need to look at a supraglottic airway, and these are weight adjusted so that we can assess that this patient is probably somewhere in the 70 kilogram range, and this size 4 eye gel is for 50 to 90 kilograms, so we know that this one will be adequate for this patient. Keeping a sterile field, the thermoplastic structure of this eye gel means that it's very soft at the end and it will adjust to the shape of the patient's oropharynx when it's inserted and when it warms up to body temperature. However, given the nature of the plastic, it's quite sticky as well, so we do need to make sure that we lubricate the back of the eye gel prior to use, and a good method for doing that is to smear some gel onto there and then lubricating just the back of the eye gel, keeping the gel off of the front, and this is the part that sits over the opening to the larynx. A good method for inserting this is to hold it like a pen, okay, and to make sure that the patient's head is tilted back. Remove the existing airway that's become inadequate and insert the tip of the eye gel towards the hard palate of the mouth, using your index finger to push it backwards and upwards. And as the eye gel fits into place, it almost feels like it will just slots in there. We need to make sure that it is inserted and it is working correctly. So to do so, we would connect a catheter mount, reach for a bag of mask, connect the bag of mask to there, and then gently looking for rise and fall of the chest, and we would confirm correct placement using a stethoscope. Once we've confirmed that the eye gel is in place and the patient's lungs are ventilating, we need to secure that in place. And there are a number of methods that work well. The good old K-band is great for securing this device in place. Once it's secured in place, confirm with the stethoscope.